Hello and welcome to NHIS in a Week, where we give you the highlights and happenings of the authority and the scheme. My name is Shanice Palm. Now to our headlines. NHIS welcomes new Deputy Chief Executive and senior officials. And PMAG delegation pays courtesy visits to NHIA. To our first story. The National Health Insurance Authority has officially welcomed its newly appointed Deputy Chief Executives and senior officials.
At a brief ceremony held at the NHIA head office, Dr. Senanu Kwesi Jokoto was introduced as Deputy Chief Executive in charge of operations, while Mr. Raphael Yefoglo Sekpe takes on the role as Deputy Chief Executive for Administration and Human Resources. The Chief Executive of NHIA, Dr. Victor Asaribampo, also announced the appointment of Ms. Faustina Derry as Head of Corporate Communications and Dr. Anthony Gingon as Senior Director for Special Initiatives and Liaison to the Ministry of Health. These appointments are expected to strengthen the NHIA's mission of delivering accessible and efficient healthcare services across Ghana.
A delegation from the Pharmaceutical Manufacturers Association of Ghana, PMAG, has paid a courtesy visit to NHIA to congratulate the newly appointed Chief Executive and discuss key industry concerns.
Led by PMAG President Mr. Samuel Amotobin, the delegation raised issues surrounding reimbursements delays and proposed that payments be made directly to pharmaceutical manufacturers rather than through healthcare providers.
So we wanted to engage to find out whether payments can be made directly to us. We know that sometimes people are on a contract with us and all of that, but as we work closely together in ensuring that medicines are available to you, ensuring that you get the best and all of that, I think that we need to have a certain relationship so that once you take care of us, we also take care of you and then the patient is well taken care of.
NHIA's Chief Executive Dr. Victor Asaribampo assured the delegation of the government's commitment to supporting local pharmaceutical manufacturers and working towards solutions that ensure timely payments and price adjustments.
The budget will be read tomorrow. We are hopeful that as soon as it is read, we'll be giving some allocations, because I think in 2024 some progress was made in terms of timely payments, and we want to continue with that. Government is committed. From all indications, the uncapping will happen, but I think Gustav explained about how it will affect our budget. We also are committed to doing the free primary health care and the Mahama care, so definitely there will be some extra resources that the president says we should be ring-fenced. So we hope that these resource constraints issues would be kind of sorted out and we can pay in a more timely manner. That is at least where we want to get to.
To our next story, the NHIA has set an ambitious target of registering 21.08 million members in 2025, representing 62.5% of Ghana's population.
According to Mr. Francis O.T. Frimpong, the Director of Membership and Regional Operations, NHIA is focusing on increasing indigent enrollment and expanding access to digital registration and community outreach initiatives.
The organization had a medium-term strategic plan that was from 2021 to 2025 or so. And our area was to look at the membership. With regards to the achievement of the UHC or universal health coverage, there is that population arm where we need to get more members enrolled onto the scheme. And by they having the card, it could grant them or give them the access to visit any of our credential facilities when they happen to fall sick. So as per the strategic plan, we thought we were going to do maybe 3% jump almost every year. I think 2021 we're at 54%. So I think that we were to do 3% increase every year, so that by 2025 we might have done about 66%. And then we also leverage on what we have done in 2025 to plan for the years ahead, so that by 2030 we should be having a minimum of 80% coverage.
NHIA remains committed to achieving universal health coverage and urges all Ghanaians to take advantage of NHIS benefits.
NHIS Corporate Affairs Directorate has launched a sensitization campaign to educate the public on the NHIS benefits package.
The outreach team visited Cocoa Clinic, Kaneshi Polyclinic, and Theresa Maternity and Child Health Clinic, where they interacted with patients and hospital administrators. Topics discussed included the My NHIS app, mobile renewal via *929# and free maternal health care. NHIA officials encourage the public to use these digital tools for easier access to NHIS services.
To our final story, the Northern Regional Office of NHIA has achieved 74% of its NHIS active membership targets for 2024. At the annual performance review meeting in Tamale, Acting Regional Director Mr. Abdullahi Al-Hassan Nambili praised staff for their dedication and emphasized the importance of digital tools and community engagement in expanding membership. NHIA is adopting innovative strategies, including mobile renewals and local partnerships, to ensure increased membership coverage in 2025.
Question of the day.
Afi etwe mu no na me wo health insurance card no bi nanso manfa nkwa yaresabia esanse yare bia mbome yesi afifufuro imu etwa semi sentie bibi kakra ansa na metimi de card no akwa yaresabia na
Anio, emfa ho sa wo de card ne ko hospital na wanfa nko afie bia no ese wotua kakra ye friend premium no na ma card no etimi edemu hyane nso wona anya mfie edioson edeko ene wona otua ntotoso emma senet ne de wonka ho aya kai so be dial *929# na wafa option 2 we de share ne so.
You should tell me rough off. I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be pedroni boarding.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam from National Health Insurance Scheme. I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith in you. Listen, let me tell you, there's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power Fee, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Don't forget to dial *929# to follow the prompt and keep your membership active. Well, that's all that we have for you in this week's edition of NHIS in a Week. For more information, do log on to our website www.nhis.gov.gh or do follow our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.